Hi, very good morning, everyone. Um, Welcome to our morning session on Saturdays. We are sitting on 4th of May, 2024. Today, we have joining us with us Mr. Gowtham Pandiaraj. He's talking about energy source we need to know and its uses in the modern medicine. Uh, our speaker has joined in from Bangalore. Dr. Gautam is fellowship in advanced laparoscopy surgery awarded by Indian Association of Gastroendosurgeon. He's completed his MBBS in 2015 with a distinction in social preventive medicine and general surgeon from Rajan Muthia Medical College, lately known as Cuddalore Government Medicine Medical College. He has completed his MMS. He's completed his MS from MMCHRI from Chennai. He has completed his senior's residency from Mahatma Gandhi Medical College in Pondicherry and was being promoted as an assistant professor in the same institute where he held multiple responsibilities, including able-bodied member of palliative medicine. He has also an experience in surgical registrar in Fortis Hospital. Sir, over to you.
Thank you, Dr. Saurav. Hope I'm good and visible.
Yes.
Yes. Good morning to everyone. Actually, I'm very surprised as well as pleasure to meet all of you through this meeting because I know I'm not very big in my academic career or as my current present status is concerned. I'm just in my early 30s and I'm doing my fellowship and I hope I'll make this topic very crisp and clear for all of you what to be learn and to be known. Am I good to go?
Absolutely.
Thank you. So we all know that energy can neither be created nor be destroyed, but can be transferred from one place to the other or one form to the other. This is what we would have been heard when we are in kindergartens or sometime in our early school time. So where does this energy flow through or how it flow through? It flows from the area where it has lesser resistance to go. Say if there is no resistance or low impedance, in other words, the flow will be more. When we compare to a water media, salt water conducts water more when compared to a normal water, something like that. So the tissues like fat or when compared to a nervous tissue, the fat tissue transmit current in a very lesser manner. So we have to understand this before we go into anything else. The base of current or the electric charge happens in two different forms. Either it is in a direct current or in a alternating current. So this alternating current is nothing but the spikes as well as the break of the wave current, so that it has its upside and downside way in a sinusoidal fashion. Whereas a direct current flows in a unidirectional fashion, and it has its own advantages and disadvantages. Ohm's law is something that we have to understand before going to any of this, which is the voltage is directly proportional to the impedance and the electric current resistance. So the current is alternatively proportional to the voltage and inversely proportional to the resistance. When the resistance is more, the intensity of current going will be comparatively less. To talk about something else in the what happens to the body tissue, we have to talk about something called a Joule's law, which is nothing but the heat produced out of the electric current, which is nothing but the intensity of the current's square proportion is, and as well as the resistance and time duration that is given to make the flow of the current will resulting in the heat production. So whenever current is traveled from one part of the source to the other part of the source, it tends to produce some amount of dissipation. This dissipation could be heat, could be smoke, could be anything else, which is nothing but its form of wastage. No energy instrument in the entire world so far is like 100% available for its resource. So the thermal effect of the tissue is all is square root of its current density. This is what the formula we always keep in mind before going on anything. Now we talk about this electric circuit. We have this electric circuit or the electric surgical unit, which is produced by the alternative current, and it delivers its to the tissue either via monopolar or bipolar instrument, which we are going to talk about further today. And this electric current change is going to be perceived by the intracellular energy, which will be either in the form of electromagnetic energy or in the kinetic energy or thermal energy, which is going to cause the desired effect. Either it could be a vaporization or a fulguration or a desiccation, or also known as the coagulation. Depending upon the amount of heat it is going to produce out of it. See, generally, when a current is traveling, it either travels in a sinusoidal fashion or in a straight fashion, as I said. So, coming to this electrocautery or electrosurgery, the first or existing kind of electrocautery machine was designed or it is prepared by a biophysicist by name William Bowie. He gave this concept of electrosurgery unit or electrocautery unit, which he said like based on the principle of Arnold stating that when a electric high frequency radio frequency current is passing through the tissue, it fails to produce any amount of neurostimulus or muscular stimulation. So this when needed by and recorded by a later part of the people came to know that whenever the frequency is very very much maximum, it fails to produce any more the stimulation. This forms the basic of our electrocautery unit. So electric cautery is nothing but the use of electricity to heat an object that is used to heat a specific site, which includes a copper wire or a hot wire. We use iron box in this fashion. And when it comes to electrosurgery unit, the same electric energy is used to heat the tissue, but in which in the desired effect by means of the hopefully a generator. So the agenda of this class was to explain about how about the monopolar and bipolar, how they works and how they functions, and what are its drawbacks, and how are they helping with the next mechanism. The other tissue adaptive systems like Ligashore, NC, Sonician, Harmonic, and Thunderbeats. So the electrosurgical unit is easily influenced by the waveform or which is going to travel, and the power setting, whether it is going to be a low volt setting or high volt setting, and the size of the electrode that is we are going to use, and the activation time, how much we are going to use it for a particular stimulus or to make the use to happen, on the manipulation of the tissue, sometimes the type of tissue you per se. Remember, I just said like the fat has a more resistance, whereas the nerve has the least resistance. And eschar that is formed out of the bones also has the this particular effect. On your right is the instrument what we called as the electrocautery device itself, which is used most by the dermatologists for the day-to-day practice. Also, for it has a foot pedal and a cautery pencil, which has a unidirectional flow by either cutting or a bipolar coagulation mode. So this is like how a proper electro or OT setup will be like. But I wanna you people to just look at the floor of the OT where we can see a metal shield, which I have just also marked by the arrow mark. That is called as a conductive tile, which used to conduct the current. Whenever there is any seepage of current happens through the body, the table itself will act as a current media or the receiving media, which in turn will ground to this uh, conductive tile. So whenever we see a operation theater, the center of the operation table will be having this particular circuit, not just for to keep or fix the table in situ, but also the amount of conductive tile will be there next to it, which you can, which is to make sure the conduction or the grounding is happening. So what is this cutting? What is this coagulation? How it is? It will be helping by the surgeons or the modern day practitioners. See, it is very simple to use these instruments once we know what is the base of everything. Say, cutting is nothing but making incision out of a patient's body or any other part of the tissue. But to make it in a electrocautery or electrosurgical setup, we need the current to flow in a high frequency state and in a low voltage state. In this scenario, when we use it, it make a precise cut, and usually we used to have a sharp tip to make this cutting to happen. Whenever cutting is happening, it tends to produce amount of energy as much as 600 degrees centigrade of thermal energy we could get, and last but not least, the more amount of smoke will be producing out of cutting rather than anything else. Whenever a coagulation is concerned, it uses a low frequency and high voltage current, and which needs less number of time to act, which causes coagulation to happen. This is similar to what we use for our day-to-day practice to just boil the egg, which contains protein. When we boiling, it will be solidified, which again is also known as a coagulation in term. There are two types of coagulation that happens. One is fulguration, other is desiccation. Fulguration is nothing but no contact electrocautery activity that makes the coagulation to happen, whereas the desiccation is nothing but the contact mode of deep coagulation. So when it comes to coagulation, again, we have two different kind of coagulation. One is obliterative coagulation, obligate coagulation, which is nothing but we keep our electrocortic pencil directly over the tissue, over the bleeding vessel, so that the coagulation or the hemostasis happens. This is usually used for vessels less than 0.5 millimeter when it is in the subdermal plexus or somewhere. But when it comes to deep plexus or whenever we are in a muscle plane or sometime, we use some better instrument, something like we hold the bleeding vessel and we try to cauterize it, which will be of size approximately up to 1.5 millimeter. So these two different way of coagulation we usually follows for the hemostasis to be in a secure way. And when it comes to this cutting current, it could be either pure, which is nothing but a straight clear way of cutting, and the amount of thermal dissipation will be more, whereas the coagulation or the lateral damage will be comparatively less. As you can see in the down slide, where we can see the amount of red meat is being incised by the cutting current, which is a pure cut, and the amount of lateral dissipation is like very less. The amount of yellow or coagulated part is like very low. When it comes to a blend current, it makes a very precise, rather a very drastic current, and also it has a minimal amount of coagulation property. And there is another picture to show the fulguration how it happens, which is a non-contact coagulation. So these are the different types of or different amount of energy dissipation that happens whenever high frequency electrode is being placed over the tissue. The immediate place will be going for vaporization, which is nothing but dehydration of the particular tissue. And the next area that will go for is the carbonization, also called as a HR formation. Below that, it will be going for desiccation, which is nothing but a contact way, a non-contact way of coagulation. Then comes the coagulation, which happen to the very more lateral tissue, and the deventilation will be happening, which makes a point of demarcation between a coagulated tissue and non-coagulated tissue, and the rest of the places will be having this hyperthemia. This hyperthemia edges will later become develops as a scar tissue. And last but not least, out of this heat energy transmission happening, the vapor will be coming out of the body as a waste or excreta. So this is how the energy that is used in a electric cauteric urine. When it comes to pure current, pure cutting current, it uses almost 100% of the energy very precisely and in a high frequency manner and in a low voltage manner. When it comes to coagulation, it implies over the high amplitude, high voltage current and in a lesser frequency. So the amount of energy that is used by a coagulation current will be comparatively 6% of what was used by the cutting current. There are three different entities called blend 1, blend 2, blend 3, depending upon the amount of energy it is being used. So which is 50% often known as called as blend 1, 40% on and 60% of is blend 2, and 25% of the current of what it is used in blend 3. Preferably in robotic surgery, we prefer to use this blend 2 type of cautery setup. And in endo surgery or in laparoscopic techniques, we use either blend 2 or blend 3. So the dermatologist or the dermatosurgery people who use this fulguration and other way of techniques to remove a warts, sometimes to remove a corner, sometimes they directly uses the electrocauteric machine, which uses the electric current per se, the alternating current directly to the patient's tissue, rather than using a cautery machine which can generate the alternating current into a radio frequency current, which then be transmitted to the electrode, which then cause the desired effect. So the desired effect will be like depending upon the grade of temperature, the way of its result matters. When it is about 45 to 50 degrees centigrade, there will be collagen uncoiling happen within the tissue, and the annihilation process will happen, which leads to tissue necrosis. When the tissue is when the is exposed above 60 degree of centigrade, there will be irreversible protein denaturation will happen, following the coagulation necrosis, and blanching will happen. So still this place it become irreversible. Rather than this, we cannot revert back the tissue. So the 80 degree of centigrade heat is exposed. It causes the carbonization or the initiation of the eschar formation, and which caused by the drying and shrinkage of the tissue. When the tissue is exposed to 90 to 100 degree of centigrade, there will be a complete cellular destruction followed by vaporization, and the plume of gas or smoke will be exposed out of the tissue. These tissues are also called tissue vapor, or also called as surgical smoke, which has all the vital microorganisms or inactivated viruses that is present within the cell to get dissipated. So this electrocautery water vaporization is that effect. And when the tissue has been burnt or it has been cauterized over 125 degrees centigrade, this causes complete oxidation of the proteins and lipids and carbon residue, and the eschar complete formation will happen. Furthermore, any usage of this electrocautery unit over the particular site will make sure the energy is not getting transmitted, because it forms a seal-off layer between the normal tissue and the exposed tissue. So these are the various amount of cycles of current we use. Matlab the 60 cycles per 60,000 cycles per second of what we use for our normal household activity. The what we use in our endosurgical or cautery unit will be like around 33,000 or 33 million megahertz to 500 kilohertz of current mode. So this is how a endosurgery or electrocautery unit will be like. It has three different modes, either cutting, coagulation, or bipolar. You can see this different mode setups like low, pure, blended, and endo. Endo, I said it is of 2 or 3. Blended, it is 1. Pure, it is pure current. Low is low setting of the pure current. And when it comes to coagulation, we have a spray fulguration and soft mode. And last but not least, when it comes to bipolar, it is either micro or macro unit or a cauterization unit. Above this particular machine, we can see a part of diagram. I'll just explain you this. See, when we have this monopolar current passing through the electrode to the patient's body, there has to be a return electrode that happens to come out of the dissipated amount of energy to revert back to the electrosurgical unit. This happens via the electric pad or a ground pad, which can be kept in the places as shown in the figure. Whenever a electrocautery unit is being used, if it is going to be in the lower part of the abdomen, better to keep it in the back. If it is going to be in the upper part of the abdomen, better to keep it in the low and back. So these are like the figures that is showing a schematic diagram of a person where the cautery pad can be exposed. And this also gives us what amount of energy to be used and what is the setting we have to keep. See, there are few holes in this setup. The monopolar is having a single large lumen and two small lumen over next to it. And the bipolar has two different small setup of holes for the connection to happen. And last but not least, the patient, that is called as a patient return back electrode. So nowadays, this impedance machine has a return back mechanism. It will say whether the patient's ground pad is attached properly or not. So this, I think I have already explained. The only thing I want to talk about is the crest, which is nothing but a peak voltage of the electric current which is divided by the square mean root of the voltage. This will comes to the value whichever is the value will depends. It will determines the amount of energy that is being dissipated to the patient's body. For a cutting current, it is usually low. For a cutting current, the crest value will be almost 1.4 to 5. For a blended current, it will be like 2 to 2.5. And whenever it is a desiccation mode, the amount of crest value will be 3 or more. And when it comes to a coagulation, it will be, a direct coagulation, which will be around 7 to 8. So this fulguration is like a non-typical non-contact coagulation where the electric current sparks from the active electrode to the body tissue without even contact. So there is a rule called Tate's rule. Whenever a surgeon is holding the electrocontact pencil, is the person who must hold the either the foot pedal of the electrocautery device, because to avoid unnatural communication and unwanted electric burns. Electric burns that can happen to the patient's body is always offensible, legally offensible crime. So this is how the different impedance for the particular tissue we can use, and this just gives the amount of energy that is being used by two different manufacturing unit causing the same amount of cutting current. So the one with the force is like the one that is having the peak, and it is in a very, we can give energy at wherever the setting we can keep. But whereas the other, whatever the convention what we use will take some time for to get into action. So ground plate, as I said, it is also called as the dispersive pad or the return electrode that is being kept over the patient's body, hopefully in the back. It could be either silicon pad or it could be a electrofoil unit. We need to keep a good lubricant over this element or this ground pad and stick it to the patient's body. Uh, the ideal ground pad must be of about 100 centimeters square. But if the patient's BMI or the patient's body surface area is like more than exceeding, it is always advisable to keep two electrode pads and connect it to a single electrode machine. These are different types of cable. What we use, its usual length will be like around 300 centimeter, which is like more than enough for to run on the patient, and its diameter will be like 4 millimeter. So the whatever the two plugs are there in the left corner are always the bipolar unit, and a single corner or the monopolar unit. The one in the lower of the left is nothing but the bipolar endo unit, and the one in the top on the right is the endo cutting unit. So the cartridge pencil is the one that delivers the current to the patient's body. It has two buttons. One is of yellow that causes the cutting, and the blue that causes the coagulation. Nowadays there are the length adjustable pencil tips are available, and the pencils also are provided with light source, and even to advancement the pen tips has been given with the evacuation chamber to remove the smoke out of the patient's body. These smokes are like nowadays classified as a class 2 mutagens, and they have a carcinogenic property too. These are the different types of other electrocaustic tips. Could be blend, could be blade, could be ball, and loop, needle, and extended knife. Blunt is or tip is what we needle is what we always use for a cutting property, whereas the one with the more surface area will be used for the coagulation. And this particular ball kind of endo tip will be mostly used for the hysteroscopic procedures, and loop will be mostly used for this colonoscopy or endoscopic procedures. And the pictures just dissipates out of a classic book how the polyp is being removed out of the patient's body. So the first the snare is or loop is placed over the polyp, and then it is tightened and crushed to make sure the some amount of hemostasis is happened, and then the electric unit is way into action, and that causing the desiccation of the patient's polyp tip. These are the endo units. One is called V shear on the right, and the other is the hook on the left. Hook is what the most commonly used as well as the most dangerous instruments ever that could be used by any person in the laparoscopic surgeries. It has three different parts. One is the tip, other is the shack or the shoulder, other is the elbow. The elbow is most likely used for the coagulation, whereas the tip is used for the cutting. So you remember this particular endo unit has a blending action, which is cutting as well as the coagulation. So whatever it is used in the endo, it will be having both the action. So depending upon the thickness of the um, material, it does this particular action. And these instruments are nothing but the robotic instrument. The first one over the left corner is the spatula, and then the right is the scissors, unipolar scissors, and in the rightmost top is the Maryland, or we call as a microstat. There are few advantages of monopolar over bipolar. Monopolar current can be kept over any person. It can be used in uh, as in a local surface also. But whereas bipolar, it has even more better advantages, stating the active and passive or return electrodes will be just few millimeters away, just like prongs what we used to hold. And there is no lateral dissipation of energy, and the reverse current will be go back to the electrode through the same channel. And whenever this is being used, we I remember stating that the micro and the macro type of modes. The micro cutting mode will be producing that amount of dissipation energy into the patient's tissue, and it will be more available whenever it is present in the wet wet kind of or hydrophilic state. That is the reason why sometimes earlier the staff nurses over there, they used to have a loaded syringe with saline. They used to push it over the patient's body whenever the bipolar is being used. So this bipolar cautery is also called as a wet surgery. When it comes to surgeries like TURP surgery, which is nothing but a transurethral resection of prostate or a T or biopsy, though where the endosurgical unit will be placing in a distilled water channel, and the cautery machine is used as a endo bipolar rather than using a monopolar, because monopolar has a more dissipation chances, whereas the current will traverse it. Whereas this bipolar cautery will never get traversed, rather the water environment will give them good amount of energy to dissipate back, no, not to dissipate back. And distilled water is more used in TURP surgery to make the environment more water cooled. So this is how the two prongs held by the tissue is the energy current is flowing through it and causing the coagulation. Bipolar causes more of coagulation rather than cutting, and bipolar causes more of lesser of energy dissipation. And this is the Kepler forceps where we use it in endosurgical unit, which has a spring action and it can hold the tissue, and it will be producing effect in the place where it just held. There won't be any lateral dissipation. The advantages of this electrosurgical unit includes this precision control, and the loss of blood will be very minimalized, and tissue vaporization will be there, and the sealing of blood vessels will be very perfect, and there will be less scarring, and there will be decreased postoperative pain. But there we need, whenever a vessel is sealed completely by a bipolar, we need some other extra device like a cutting forceps or cutting device to cut the sealed part. This disadvantages are being taken care by some other instruments that we are going to see up now. So whenever a monopolar unit is being used, there is always a chance for it to get intervened with the body metal tissue implants, sometimes with the processes, sometimes with the pacemakers. So whenever a pacemaker is about to get used with any patient, even if it is going to be in the endo mode, we make sure there is asynchronization is happening to us prior to the surgery, and after surgery, maybe after half an hour later, we try to do the synchronization back. So when then next we comes to this adaptive tissue technology, which has a control feedback mechanism, something like what we can even say as a AI mediator. There's sometimes it gives audio feedback to the surgeon, stating that the whatever is the amount of energy that is to be dissipated is dissipated, and the tissue has already been necrosed. No need to use the energy anymore. So this kind of feedback mechanism is there, and some energy devices are even more vigorously advanced in such a way that it can itself since the tissues are have done its function, so we'll stop the electrosurgical energy flow to happen. So this feedback can be either energy temperature based or tissue impedance based. The pulsed electrical transfer happens in a continuous way, and the current and voltage generated by the unit has a feedback over it. The first and the best of everything to use is the ligashore, which has which is nothing but advanced bipolar in simple terms to say. It is available in different sizes, in different formats, and it has its own disadvantages too. I don't disagree. It has two different shares, and both of them are active. and it has a separate purple button in the down, which when activated, amount of blade or cutting happens between the tissues. So it doesn't need any other separate instrument to make the cut to happen. In the left corner is the electrosurgery unit, which is called a force triad, which we can connect it to both the monopolar unit as well as the bipolar unit, same as it can be used for the ligature also. So this pressure controlled radio frequency current helps in the sealing of the vessel, and it has its own mechanism to cut it over between the jaws. And this instrument uses level 4 artificial intelligence. Prior it was using level 2, and the impedance feedback will happen at a rate more than 3,333 times per second. Legacy is a very good holding vessel, and it can seal up to 7 millimeter of a vessel, which is good enough to hold any sphenic vessel, good enough to hold any mesenteric vessel. And the maximum temperature that can get out of Legasure is like 100 degrees centigrade. So this is how the Legasure holds the vessel or the tissue. And there will be two different sounds we can get. The minimum is what we use for make the coagulation to happen. Once the sound has reached its maximum, then we can press the violet button, which we can just press it harder, and the cutting blade will comes through and makes the its functioning. After repeated use, the ligature tip may be very sticky because of the unnaturated coagulum formed because of the tissue. And sometimes the incomplete sealing and extra activated cutting may cause torrential bleeding. To make advantage to the ligature, next comes this end seal, which functions in a principle of thermofusion and desiccation rather than causing a coagulation. And these jaws are very longer, as much as 38 millimeter, and it has advantage of 360-degree rotation, which is not possible by a ligature. And only one among the two jaw is having the active or energy dissipation, whereas the other will function as an insulator. And it functions in a smart electrode technology. The vessel or the tissue is being held by the NC, the current pass through, so the radio frequency current pass through, and it produces the tissue transaction as then the dissipation. Plasmation is a next advanced energy source, which is not of very much popular. It uses the Gyrus 400 generator, and it has serrated jaws, and it produces a vapor pulse coagulation. It produces more of a tissue sealing and bipolar cutting. So bipolar machine per se, when it is being used for longer time, it may produces the cutting. And there is no tissue feedback, and only the audio feedback is there. Whereas in Legasure, we have the tissue feedback per se. So these are the three different instruments that we use, and this ligature rotation is like not much that much possible, whereas NSEAL has this 360-degree rotation, and Gyrus has its own mechanism to advance the bipolar activity. So we are done with the radio frequency energy source that is used. Now we comes to the ultrasonic, which is even more advanced one. The base of everything to use is a harmonic, which is comparatively bit costlier than the rest of the energy devices, for the fact that it needs to be, we need to replace the handle of the instrument once in some time, because that it is already programmed stating that not more than 100 cases it will go. When patients are crossed with 100 cases are done with a particular harmonic handle, it will stimulate itself, stating that the sense back mechanism will say the machine is no longer useful. It uses the waveform more than 55,000 hertz produced by the piezoelectric effect at the tip of the active shear. So this disrupts the hydrogen bond within the tissue, and that produces a sticky coagulum at lower temperature. The temperature that is being produced by the harmonic will be not more than 80 degrees centigrade, and it produces comparatively lesser sharing as well as lesser smoke. And the amount of post-operative adhesions is also comparatively lower. So this is the articulating jaw in the upper, and the lower is the passive or the non-articulating jaw, which is nothing but an insulator. So in a harmonic, only the active jaw will be moving, not the passive jaw. And it always can hold a 5 millimeter of a tissue, and it produces high frequency vibration, which acts as a saw-like effect over the tissue, just like this. So this jaw-like action will makes the tissue get sealed completely, and later to effect it produces the sealing. It makes the cutting of the tissue. Through histologically, we were able to prove the fact that harmonic scalpel can produce at least 1 to 2 millimeter of coagulation beyond its point of usage. So this will be the classic harmonic energy source, and the cable that has been used for it, and it has two different modes, 3 and 5. 5 will be more for cutting and less for coagulation, whereas the 3 will be more for coagulation rather than cutting. So this instrument consists of a transducer, hand grip, and a long blade. The upper blade will be is also called as a tissue pad, which can produce this vibration in a saw-like fashion, and that denaturates the protein by disintegrating the hydrogen bond and causes the sticky coagulant. Whereas the it comes in five power levels, as I already said. And nowadays, a new harmonic called a +7 ACE can produce a ceiling of up to 7 millimeter. Next comes to the CUSA, which is like an advanced instrument of all. The ultrasonic desiccation is introduced in 1976, which combined with the suction and irrigation effect can be used in the places where there is more of water content and less of blood flow. And it comes with handpiece extension could be of 30 centimeter or 10 millimeter diameter. So this is a acoustic vibrator which has a coupler, and it has an interchangeable tip with frequencies which will be oscillating in a frequency of 23,000 hertz. So this quasar has its own advantage, stating that it itself will cut the tissue as well as it can irrigate the field, and it can also aspirate the contents. It is used in the places where there is more content, more water content with alternating positive and negative pressure that agitates the molecules of the liquid particles. And during the negative phase of this cavitation, this enlarges in the size continuously, and there is a chance of bubbling happening within the tissue, and there is a chance of rapid alteration of the phases. This cell will explode out of the into fragments out of the CUSA, and it will be taken into by the suction. This is used for more for liver resection, sometimes for nephrectomy. Next comes advantageous element with the no card, which is cableless. It can be more likely used by the person who is traveling, or someone who used to do surgery at frequent at many number of places, which has advantage of harmonic and has advantage of being carried in a easy format, which contains a replaceable batteries. The handle doesn't comes with any other impedance factor that we need to change it after 100 cycles or 100 hours. So these has a disposable batteries, and the shears are strong enough, made up of titanium. So only disadvantage out of this is like it is heavyweight, and it is very tedious to hold for longer cases. And whenever we feel like running out of battery, we can use the battery but then and there itself. So it doesn't depends on any external energy source per se, rather than for the battery to get into action. Then comes Thunderbeat, which has advantage of all, which simultaneously uses both a harmonic device as well as a bipolar device. It usually uses the ultrasonically generated friction heat energy, and it causes a higher bursting pressure over the tissue, and there will be highly reduced thermal spread, and there is no separate blade is required for the cutting, like what we see in the thermosil or in the ligature. Then comes Aspilab, which has its own rotating or end turning shear tape. As you can see in the picture of the first instrument, we can literally articulate the jaws rather than just rotating it. So this has a pulse. This uses the pulse waveform modification, and it causes the least tissue charring. So for whatever we have discussed. As I said, what is a surgical smoke? It is being stated that whenever an endosurgery unit is used in laparoscopic cases, within 5 minutes of initiation of the surgery, there will be the carbon dioxide, the pneumoperitoneum, whatever is there inside, will makes the carbon monoxide out of it, and it reaches up to 345 parts per minute per million. And on an average, at every surgery, by the end of the surgery, we may expect the ppm of carbon monoxide will be around 475. But whatever is permissible was less than 19 after any surgery to happen. So these are the different chemicals that is being dissipated out of any units. That could be of xylene, toluene, benzene, formaldehyde, last but not least, the dangerous virus per se. To overcome this scenario, we have something called a pen evac. As I said, the monopolar tip with the evacuation chamber with it, which has a less number of or smoke that is being can be inhaled by any person in the operation theater. And in the left corner is the endo evacuator, which is connected to the one of the trocar per se, and this will evacuate the harmful and dangerous surgical smoke out of the surgical field. Surgical smoke can initially causes eye irritation, can cause sore throat, can cause lung irritation and emphysema. Later, it can produce carcinoma lung. Whenever energy is used, there is always a chance of the person or the surgeon who is using to get some amount of feedback, which is also called as a bow bite or a glove burn. Can happen because of high output setting, can be because of more of fulguration or spray mode technology. Sometimes the quality of glove what we use for the surgery also matters. Sometimes the surgeon's techniques like carbonization, more carbonization happening, more leakage of current, and last but not least, the open activation. Nothing but whenever cautery is not in contact with the tissue, if it is getting activated, the chance of electrical current injury is more, which is also called as open activation. So this is stated that almost 2.3% out of 1,000 patients will, at around 1970 were having this electrocutive injury. When it comes to 1990 data, it was like 2 to 5, and the current data is still in a question mark. And this electrosurgical injuries happens most likely because of the corrosive electrodes sometimes. And when it comes to endosurgical units or during endoscopic arteries or laparoscopic arteries, there will be intracorporeal electric current dissipation, which can happen at 4 different places. It could be at the tip of the instrument or at the endo view, which most likely because of the faulty placement of the instrument over the place where it not to be needed, or overactivation of the foot pedal. And second is like it could be in the portion outside the cannula but within the instrument, maybe because of the insulation failure. And third could be because of the insulation within the trocar failure, or that also called as a trocar injury, also called as a capacitive coupling. And last but not least, the handle of the instrument getting electric burn because of the improper electrocautery setup. So the direct coupling is nothing but the whenever overcrowding or chopstick effect that happens out of too many instruments happening at a particular surgery, preferably in this is being more reported in pelvic surgeries. Too many instruments will be there at a time, and one of the instrument will be touching the other instrument without notice, and that can or could have caused the problem. And in the second picture, you can see the energy dissipation happen out of the trocar rather than from the cannula. So this comes as zone 3 injury. So capacitance usually is nothing but dissipation of energy into the field where we don't want it to happen, which can happen because of the longer instrument, higher voltage setup, and the narrow diameter cannula. Whenever we use laparoscopy, we sometimes use a 10 mm trocar, over which we may use a 5 mm instrument or a cautery device. For to make the proper capping to happen, we keep one another 5 mm instrument or 5 mm cannula into the 10 mm 5 mm cannula into the 10 mm trocar, so that we feel it is secured. But rather, it may go for hybrid canalization failure or the chopstick effect. So the abnormal stimulation of the tissue is noted, stop the surgery immediately. The metal to metal sparkling can happen. If such is noted, we have to check all the connection of the energy platform and patient's return electrode and active electrode. So this energy dissipation can happen out of any low power setting, could be in fulguration or in spray mode. So the energy platform is on the instrument and it is not getting delivered. Please check the instrument for any failure. Please look for any internal component malfunction. And if needed, you please ask the biomedical engineer to service of the instrument. Sometimes the thermal injury can happen out of a faulty power cord. If such scenario, please replace the cords. And finally, the takeaway would be like, please inspect the insulation carefully and always use the low setting current, always use the low voltage waveform, and we should not always activate the probe whenever it is not needed. And whenever needed, we use a brief intermittent activation rather than using in a prolonged way. We used to call while using a hook, we need to hook the tissue, look at the tissue, and then hook the tissue. This formula we always follows. I hope we should not always activate in a close proximity or in direct contact with any other instrument. And whenever in open circuit, which is nothing but we should not use it when it is not in contact with the tissue. And the bipolar cutter is always preferred, and always use a selective hybrid cannula, which is always the safest. So sometimes the electrode pins may be compromised. We may need to replace it. Sometimes this troubleshooting needed to cool the liquids around the tissue, which can happen to minimize or remove the excess fluid within. So there are few different or a few newer technologies arise, something like voice command energy system. The energy system can itself will function only when the surgeon or someone person is giving the voice. The voice can be fed to the machine prior to the surgery, so that it listens to the particular person's voice rather than to anyone else's. And we have active electron monitoring system and oscilloscope. We need to run this instrument once in a while to make sure there is no insulation failures. Electrocautery burn is a serious criminal negligence as far as Indian legal penalization is concerned. So when it comes to final topic or choice of the hair, it is either a harmonic, ligasaur or thunderbeat, out of which what is used or FDA approved. I preferably choose a ligasaur is more good and best. So we have the cutting instrument as well as the coagulation instrument, and this energy dissipation is like very low. And even though it is cutting, we should be very careful while it is performed. So these are the different tips that we can use out of any monopolar cautery unit. And thank you. Is there any questions?
Thank you for a great presentation. I'm going to say that for those of us who are not in the surgical fields, it is very enlightening to know how much care and thought is used in the instruments that you are using. And in terms of potential complications if you're not using the right tool at the right time, at the right tissue. And I think your presentation was fantastic. Thank you very much.
Thank you, Monica.
Thank you, Dr. Gowtham. We have Dr. Chong. Dr. Chong.
Thank you, Dr. Gowtham, for that wonderful presentation. As Monica has pointed out, I'm a physician, so I'm left my surgery behind long time ago. But nevertheless, it's a very good update on the topic, and I appreciate very much what you've told us today. Thank you.
Thank you, sir. Thank you.
Do we have any other questions on the floor? I'm sure there would be a lot less questions today. So, Dr. Gowtham, I believe Thank you for the great presentation. I think these instruments we have all seen somewhere, and it's good to know about them. We are right on the time today to wind up the session. If we don't have any other questions, we would like to wind up the session. Okay. So Dr. Gowtham, thank you so much for joining in. It was an insightful information, very knowledgeable. And we are thankful for you to join us while on your busy day. So thank you so much. See you again. Thank you, audience.
Thank you, Dr. Saurabh. Thank you. Thank you.
Thank you. Thank you very much. Bye.
Thank you.